I'm Michelle Grosvenor from the Associated Psychology Practice, and today I'm talking about social anxiety. Social anxiety is a condition which makes it difficult for people to take part in everyday social interactions, such as making a phone call, making a purchase at a supermarket where they have to talk to someone, having dinner with friends, attending parties or social functions. For people with social anxiety, it's more than shyness. They actually can feel physically and emotionally quite overwhelmed, terrified even, by the prospect of talking to others. What research has found is that most of the fear comes from initially from the predictions people make before going into the social situation. Often people with social anxiety will predict stumbling, saying the wrong thing, and feeling intense embarrassment. Also, whilst people with social anxiety are in social situations, they tend to become quite preoccupied by a fear that other people might notice some signs of their discomfort. So they might become really worried that people will notice that they've blushed or they've stuttered or that they've said the wrong word. And as a result of that, they can find it really hard to engage in conversation with others because their mind is elsewhere. Social anxiety can also affect people after social events. So people with social anxiety often review a social situation afterwards, and when they do so, they tend to focus on anything that they think they did wrong. So they can become very preoccupied by what most people would probably see as a minor stumble or not finding a word fast enough, that type of thing, and can then sometimes overgeneralise and say that the whole event was a disaster. So some really important things when looking at social anxiety are that our thinking patterns affect how we perceive the situation and how we respond. If you're having trouble with making lots of negative predictions about social situations, being extremely tense and anxious while you're in a social situation, or endlessly going over what you think you did wrong, I'd really encourage you to seek the help of a psychologist to help you to understand which unhelpful thinking patterns might be affecting your experience. If you'd like more information, please look at our website at Associated Psychology Practice. Thank you very much.